Hi, everybody. I, Jeremy, recently learned that I have obstructive sleep apnea, and I've undergone all kinds of different treatments for it. And because of this, become an expert on how common it is, especially in people with diabetes. So we're going to get into this on today's episode of the Taking Control of Your Diabetes podcast. I am one of your hosts, Dr. Jeremy Pettus, joined as always by my good friend and colleague,
Dr. Steve Edelman.
And so if you're listening, great. But if you're watching on YouTube, we have a little bit of a different arrangement where I'm just looking eye to eye with Steve today, which I really appreciate. You're not just like kind of over to the side of me. But this is fantastic. So if you're just tuning in, Steve and I are both endocrinologists. We treat adults with diabetes, type 1 and type 2. We've both been living with type 1 diabetes since we were 15. And Steve started this organization, Taking Control of Your Diabetes, 30 years ago to educate and empower folks living with type 1. Do all kinds of stuff online. We have a newsletter, and we've been doing this podcast for about 2 years now, and still no shortage of topics. So this one is all about sleep apnea. And guess what, folks? This goes way beyond snoring. This is a real issue, and it particularly affects people with diabetes, both type 1 and type 2. So that's why we wanted to talk about what it is, how it happens, what the risk factors are, how to diagnose it, and how to treat it. So, Steve, when somebody says, what is sleep apnea? How would you explain that?
Yeah, I would say in the simplest terms is that there is an issue with the tissues of your throat, your glottis, that prevents air from flowing appropriately. It collapses, and there's a lot of reasons for that. And you don't get enough oxygen, especially while you're sleeping. And that's a serious issue. When your oxygen gets too low, there's a lot of things that happen, and primarily your daytime tiredness and loud snoring. And your bed partner, if you have one, will notice that there are periods of where you stop breathing. We call that apnea. Mm-hmm. So basically it's closing of the airways primarily at night.
Right. So I learned that apnea is defined as a cessation of breathing for 10 seconds. And that means you're not breathing for 10 seconds. And obviously, everybody knows that breathing is a good thing, but what happens when you don't breathe? Well, a lot of things happen, but one thing is that it really triggers your adrenaline, your catecholamine response. It'd be the same as if somebody put a gun to your head. Your adrenaline goes through the roof. And when that happens, guess what? Your blood pressure goes up. It can affect your heart, all these things. So it goes well beyond just how well you're sleeping, snoring, how you're feeling during the day. It can cause cardiovascular disease. It can affect your testosterone levels. So there's all kinds of issues that are wrapped up into this that often just get kind of dismissed as like, my partner snores, they might need to lose weight or whatever it is.
It's severely underdiagnosed. Yeah.
So let's talk about the symptoms. So when we talk about symptoms, people kind of break this up into symptoms at night and symptoms during the day. So we already mentioned that probably the most common thing that like would identify that this might be an issue is that people have like chronic loud snoring. This isn't, every once in a while when you've had, 6 glasses of wine that you snore. This is like in every kind of night, loud snoring. But then associated with that, not just the snoring, but these periods of apnea where you might notice your partner is like gasping, choking for air. They wake up. And the kind of wild thing is that often the person that is living with it has no idea that this is happening. It's the partner, it's whoever's in the bedroom, that actually notices this.
Maybe this is a good time to read what our graphic designer wrote me as her husband was recently diagnosed with sleep apnea. And here it is, quote, "When we first got together 15 years ago, I knew he snored really loudly, like really loudly, capitalized and bold. But then I realized it was something more when I heard him stop breathing and gasp for air for the first time. It was terrifying, and it never really got less so."
Yeah. So, and it really is like this partner thing. And not to be cute about this, but this can be like a really like an issue for couples, like can lead to marital problems. You're snoring, you're keeping me awake. The other person says, I don't snore. And the other person, like they're worried back and forth. But so that is a great quote of how this can kind of present itself. So other things that can happen at night, you're snoring, but you might just have restless sleep. You might notice that you're getting up a lot at night to go to the bathroom, to pee especially. But then during the day, guess what? I mean, if every hour I came and shook you awake, you'd be tired. You're not sleeping well. So because of that lack of sleep, the main daytime symptom is that you're tired. And as we were talking about before the podcast, so Steve, that's a tough one because you ask people if they're tired. I bet you 90% of people would be like, heck yeah, I'm tired. But it's a change. It's something that's excessive. You might actually be falling asleep in times that you weren't falling asleep before. You're in a meeting, you can't keep your eyes awake. And you mentioned even like car accidents, falling asleep at the wheel.
Jeremy, almost every bit of literature I read preparing for our podcast had that at the top, car accidents. And if you're someone listening or viewing on YouTube, if you drive like a bus or if you're an Uber driver at night and other situations where you're working at night, if you're working around heavy machinery, there's all kinds of big warnings that it could be very dangerous for you and maybe others around you.
Yeah. So being tired during the day, waking up with headaches, low energy, difficulty concentrating, changes in your mood. I mean, everybody knows when you don't sleep well, you're more irritable, like it maybe even lead to depression, things like that. But get this, decreased libido. And a very important thing for men in terms of our testosterone secretion is periods of sleep that lead to kind of increased testosterone levels. And when you're waking up frequently, you can actually have low testosterone levels just because of that. So simply treating that can increase your libido, your sexual desire, all those kinds of things. So who would have thought that, snoring could be kind of linked to testosterone, libido. So sometimes, when I see male patients, that's the thing that gets them to kind of like commit to like, okay, like, like maybe I actually do want to
let's get tested. Yeah. Well, you know what? I've thought of this analogy with diabetes. Your blood sugar's high. The glucose levels go to every organ in your body, and that's not good. But when you don't have enough oxygen, every organ in our body needs oxygen. Mm-hmm. And that's why it affects so many of our organ systems. And certainly I bet you can't help women's libido either.
Yeah, you're right.
It's not through testosterone, but you're right. It zaps the energy out of you. And that's why when we get to some of the other complications, you already mentioned heart disease, it's extremely high, with people with obstructive sleep apnea.
All right, so we talked about some of these symptoms. Again, like unfortunately, like that, a lot of these things are kind of common. So who are the people that are particularly at risk? So if we just look at the U.S. population, somewhere between 10 and 30% of people will have sleep apnea. And the main risk factor, we'll go to this kind of next, is weight and obesity. So it makes sense that as the world, and particularly the U.S., is gaining weight, well, guess what? That sleep apnea is falling right behind that. Why is that? Well, as you gain weight, you get more kind of fat everywhere, including your neck. And that just makes those structures in your neck easier to collapse. So particularly when you're lying on your back sleeping, those airways close, you can start, not getting air. So I said general population, 10 to 30%. That's already, really high. When we look at type 2 diabetes, do you have a guess, Steve?
Yeah, I know it's much, much higher, at least twice as high.
Yeah. So it's up to 80%. So the vast majority of people with type 2 diabetes are living with this. And, it's enough right there that if you have type 2, you should be screened. Like, you should consider, especially if you're snoring, you have any other risk factors. But it's so common in type 2. And not just because of the weight, but there's maybe some other issues that go along with it, particularly if people have neuropathy or neurological issues that can predispose people with type 2. So that might make sense. We think type 2, we think obesity. The one that's a little odd is that people with type 1, like you and me, are also at much higher risk. And we don't exactly know why. Even when we kind of correct for weight or look at people that have the same weight, if they're type 1 or not, that up to half of type 1s have sleep apnea.
Add it to the list, Jeremy. Yeah. You know what? I think I wouldn't have thought that because I had the old dogma of, heavy people, type 2, because they are prone to being overweight. So, as I said earlier, anybody can get sleep apnea, and it does run in families. But I don't know what type. I don't know what the theory would be.
Yeah, and to be honest, I'll tell my story in a little bit about like my whole diagnosis, but I took it personally. I still think like you said, pretty much sleep apnea, it's only a problem that like, people are really like overweight. And if you're looking, on YouTube, you can see that, as we were saying earlier, I'm shredded, Steve. Thank you. But I'm joking, but I was resistant to the diagnosis because I thought that, that was only for people that are severely overweight.
Yep.
And there is this idea also in the literature that it's not just about like how much you weigh, but people can have like certain set points that like, for me, maybe if I'm above 200 pounds, like that's when like the sleep apnea comes out. But if I'm below that, then I'm okay.
Totally.
Like there's kind of a place where it gets triggered, if you will.
Yeah. Well, it is related to weight, at least to a major degree. And we'll talk about Zepbound a little later and how it affects those people. But, it's more than weight. But weight is a big thing. And I think, maybe you reached your set point. You have been working out a lot. You've only gained 10, 15 pounds as far as I can tell around your neck. Mm-hmm. But we'll talk about the questionnaire that people can use as not a diagnostic screening questionnaire, but just kind of a raise your awareness type of questionnaire.
So let's go through these risk factors specifically. So these kind of anatomical ones first. So obesity. And, we've talked about on the show too, that obese has a definition. And it's based on your body mass index, your BMI. You can go onto Google, type in your height and your weight. It'll spit out a number. Between 25 and 30 is overweight, and over 30 is obese. So particularly if you're in that over 30 category, then, you technically are obese. This isn't just like a term that we throw around. And then also if you've got a big neck, and what does that mean? Well, for men, if you've got a shirt collar that's above 17, what is that? Is that centimeters, I'm guessing?
I think it's inches.
Is it inches?
Yeah.
Okay.
This is not a pencil neck geek.
Yeah.
It's inches.
Above 17, which, is me. You said you're 16. I think I'm 17 and a half. That's a risk factor. And then other things you might be born with, like you said, the positioning of your jaw, things that you really don't have any control over.
Yep.
What about what we call demographic information? So like most things, the risk increases as you get older, particularly over 50. So I'm safe there. Steve is well in danger zone on that one.
It goes down over 65. Just kidding. Be nice.
Men, again, don't know exactly if that's all just because men tend to be larger, if it's all weight and neck size, or if there's other issues with hormones or anything like that.
But when you look at the percent, I don't see it here on our information, but it's not like it's 80-20. It's like 55 to 45. Okay. So it's not that different.
Okay. I didn't know that. It's a good one. Postmenopausal women can be an issue. Lifestyle stuff. So things that you're doing. The biggest one is alcohol. And as I kind of said earlier that, some people have no issues with snoring or apnea at all. But if you go out and you have some drinks, those are the nights that, man, you're really snoring. Why is it happening? Well, alcohol kind of relaxes everything, including muscles, and you lose the kind of muscle tone in your neck. And again, things can collapse easier. And along those same lines, if you take any kind of sedatives, muscle relaxants, benzodiazepines, any of those kind of medications can really kind of flare this up. So,
Jeremy, is it fair to say excessive alcohol? Because I don't want to just throw alcohol like you have one or two drinks.
Yeah, I mean, I would say it's probably a scale, right? The more you drink, the more that this is going to be an issue. And on nights that you do drink, it's going to be more prominent than nights that you don't. Chances are, if you don't have any issues and you have one or two drinks, you're not going to have any issues. But if you already have some, sleep apnea, any alcohol is probably going to make it a little bit worse.
Yeah.
And those are kind of the main risk factors. So real quick on why it's important to diagnose this. Like, again, if people are saying, Steve, I'm maybe not that tired. My partner says I'm snoring. Why should I go to the trouble of getting this diagnosed?
Jeremy, obstructive sleep apnea is so strongly correlated with heart disease, congestive heart failure, dysrhythmias, heart attacks, and it's also associated with strokes and it'll cause hypertension, which of course causes all of those issues as well. And when you treat it, we'll talk about that later. The risk factors go down, so it affects your whole body and affects some major organ systems.
Yeah, and I just think that's so important that people don't realize how this can affect your whole body. And like I said, a lot of this is a link to the increase in that adrenaline levels, your epinephrine, your norepinephrine that goes up multiple times a night. So what we didn't say is when people are having these apneic episodes, it can be 100 times a night. Like literally, that's not uncommon. So multiple times a night, you're having these surges in adrenaline and activity that, can make you tired during the day, but also affect your heart, blood pressure, all that.
As you know, it can worsen insulin resistance. Mm-hmm. And you're kind of I'd say one of the world's experts of insulin resistance in type 1s. And now that type 1s are getting a little heavier and they have insulin resistance, which you've clearly shown, maybe that's the link why type 1s might be at risk.
Yeah, I mean, and clearly, the hope would be treating it would improve your insulin sensitivity, using less insulin, all that. All right. So we've scared the bejesus out of you. Now you're saying, gosh, I got diabetes. I'm at higher risk for this. How do I get screened? How do I get treated? Well, first, the first stop is your primary care doctor. And, based on your risk factors and, if you have diabetes, particularly if you're overweight, they can do these really simple questionnaires. And to be honest, I had never heard of these before. Mm-hmm. This first one's called the Stop Bang questionnaire, Stop Bang. And it's an acronym where each letter means something. And if you have a yes to one of these, you get a point. And if you have over 3, then you're at higher risk. So Stop Bang. So S is for snoring. We did this let's do it with Steve. Steve, do you snore?
Apparently I do.
Yeah. Jamie won't stop calling me about
Especially if I'm on my back, by the way.
Okay. So 1, you got 1 point for snoring. T is for tired. Are you tired during the day?
Not unusually, but yeah, of course, we all get tired during the day.
Honestly, you've got one of the highest energy levels of anybody I know.
Okay, so no.
Yeah. So we'll give you 1 point. O is for observed apneas. Has Jamie witnessed you gasping at all?
Only during certain activity. No.
Oh, stop.
No, I do not have apnea.
Okay. All right.
Sorry, I couldn't read this.
So you got 1 point. P is for pressure or high blood pressure. Do you have high blood pressure?
Okay. With the qualification, I've had it for my whole life, and it's well controlled.
Okay.
But I do have hypertension.
You have a diagnosis of high blood pressure. Okay, so you got 2 points. So that was the stop. Now we got bang. So B is for BMI over 35.
No.
A is for age over 50.
Yes.
Okay, so you got 3 right there. All right. We got snoring, high blood pressure, age, yeah. N is for neck size over 16 centimeters.
My shirt size is 16, sometimes.
It's actually over 17 for men. I just saw this.
I know. So I'm 16.
You're good. And gender is male, so that's 4.
How do you know?
So if you're anything over 3, you're at higher risk. So you can see, and not to pick on you, Steve, but it's
okay.
Not that difficult to meet those things. If you're a man over 50, you already got 2 right there, and you just need one other thing. What's weird about this is there's no diabetes on here. That seems like that would be one that would be worth a couple points. But this is a screening test that everybody could do at home. You can Google Stop Bang, and as these numbers go up, your risk goes up. So what I learned is that if you have 3, you're a 3-fold higher risk of sleep apnea. If you're 4, you're 4-fold risk. 5, things like that.
Yeah.
So it's kind of a nice scoring system.
And I think, like you said, people with type 2 diabetes who are overweight are particularly at risk. And I think the simple thing to do is ask your bed partner. If you live alone, then just pick up someone for one night and tell them why you want to sleep with them.
Yeah.
Hey, I never thought of that excuse,
watch me snore.
But if you do have a partner,
Uber snore. What?
Uber snore. If you do have a partner, ask him or her, and I think you'll get an important answer. And put it this way, if you have a bed partner and you snore like crazy, they probably already told you.
Yeah.
And once again, this doesn't make the diagnosis, but it could raise your awareness that you may have it.
And I will say, I didn't believe it. And Chloe videotaped me several times, and she's like, "Do you want to see the videos?" And I said, "Absolutely not. I believe you, but I don't watch myself snoring like a rhinoceros." Okay, so you're saying,
I want to see them now.
yeah, you want to get screened, you want to get the official diagnosis. How do you do this? Well, not that long ago, it used to be kind of complicated where you'd have to go and stay overnight in these sleep labs, and they'd hook up like these EKGs to you and all these little probes. And we still do that, but that's more for kind of complicated cases, or the diagnosis might be nebulous. Far and away, we've moved to these like home sleep tests now, where you can get from your provider these little home kits, and they usually include a couple things. There's like a little watch that you can wear, often with like a finger oxygen probe, and then sometimes like a little like strap around your chest that kind of measures your heart rate, and sometimes a little oxygen cannula that goes in your nose. And that sounds like a lot of stuff, but I actually did this, and it was really easy to use. And then it can electronically download the report and send it like right to your provider.
What did yours show?
So the reason I did this is because we got interested in this issue in our lab of why is this more common in type 1 diabetes. So we started screening a lot of our patients with type 1 diabetes, just even if they don't have symptoms, let's just see how common it is. And I said, well, I want to see how difficult this test is for us to do for our patients. Had no concern about sleep apnea myself, did the test, and I'll tell you the results. But before I tell you that, we have to tell you how to interpret that. So it comes back with all these numbers, but the main thing is what they call this apnea hypopnea index, AHI. It's essentially how many times you're waking up, during a night, more or less. And anything less than 5 is normal. And from there it goes up. So 5 to 14 is mild, 15 to 29 is moderate, and over 30 is severe. So mine came back at 15. So right in this like moderate category. And put this information together with the fact that Chloe had been telling me that I've been snoring for a long time, and then actually went to go see one of our endocrinology colleagues. Her husband is a very well-known sleep expert, and went and saw him. So I'll talk about kind of like treatment next.
But Jeremy, let me just clarify something. It's not so much waking up, it's stop breathing.
That's a good point, because I had no idea.
Right.
But this is, the cessation of breathing is these apneic episodes that are happening way more often than I thought. So that was, kind of eye-opening. And I think the point I wanted to say there is this is really easy to do. I'm not the lightest sleeper. I'm not the deepest sleeper, but I didn't mind wearing this thing. And it was certainly better than going to like some freaking lab and sleeping there overnight and all that. Yeah.
Well, like you mentioned, people who have what they say cardiopulmonary disease, like congestive heart failure or chronic lung disease, they like to bring you in. They think it's safer. And you're right. They measure AHI, but they do EEGs, electroencephalograms. Mm-hmm. They measure like EKGs all night. And I can't even imagine trying to sleep.
Now, the other interesting thing it told me was like the decibels, how loud my snoring was. And it had like the breakdown of like, mild, moderate, loud. And mine was like barely audible. So I felt pretty good about that. Like, Chloe, come on, like maybe being like a little bit like obnoxious, like here, like it actually has the decibel mark. So it was like an objective measure of how loud my snoring was. So I appreciated that.
Well, it was loud enough for your bed partner.
Yeah, I know.
So that's the criteria.
Exactly. So there's all kinds of information on this stuff that like, if you're just into health, forget about sleep apnea. It's interesting how well you sleep, how long, your heart rate, all that kind of stuff. All right. So anything else you want to say about that diagnosis, Steve? Or
you know what? I think that's it. I think the home sleep test is going to be the most practical for most people. And as you mentioned, it can be very accurate and it's not that difficult to put on. I do think it's important to get the diagnosis. But I'll tell you what, if someone came to you with every classic symptom, periods of apnea, loud snoring, being overweight, even our graphic designer's husband, he didn't even get a sleep apnea test. He got onto Zepbound, and we'll talk about that, and he got tremendously better, according to her as well. So, there are more obvious cases than not. But you were...
And I would say on the other end of that, this is very, very often not diagnosed, that this just isn't on the radar as like a serious problem, to be honest. So if you're listening, like you will probably have to ask your provider, hey, I want to get screened for this. And it's not a big ask. Think of all the blood tests we do and, constant monitoring of people, especially with these home things. They're inexpensive and easy to do.
How long do you think you've had this?
I don't know. I could just go through the list of previous girlfriends I've been with and ask them. No, I'm kidding. I've been with Chloe, 5 years or so. And she's just mentioned in the last couple of years. So it's something that, for whatever reason, kind of came on.
Yeah.
Yeah. All right. So what to do about it? Well, we got to start with lifestyle stuff, right? Before we get into medications and CPAP and surgeries and all that. So nobody wants to change their lifestyle, but here it is. Exercise. So exercise, even without weight loss, can help. Increasing muscle tone, redistribution of fat and muscle. We're not going to go into all that, but any kind of cardiovascular training, weight training. Another kind of quick one is avoiding or limiting alcohol and sedatives. If you do take sedative medications, maybe taking them at a different time or reducing the dose. Getting rid of smoking, another big one that you should just do anyways.
Yeah.
And then far and away, the big one is weight loss.
Yeah.
And, a general target is starting with something like 5% of your body weight. Excuse me. So if you're 200 pounds, that would mean losing 10 pounds, which is still a significant amount of weight. And if you've been trying to lose weight, you've been trying to do it forever. But the big breakthrough here is that we've been talking about these GLP-1 drugs forever, Ozempic, Mounjaro, for diabetes, for weight loss, for kidneys, everything.
Heart.
So the medicine Mounjaro, it's called tirzepatide. It's made by Lilly. When it's used for obesity, it's called Zepbound. And this is always very confusing to people that for the same exact drug, for different indications, it has different names. For diabetes, it's Mounjaro. For weight loss, it's Zepbound. And they specifically studied the ability of Zepbound to reduce or eliminate sleep apnea in people that were overweight and had sleep apnea. And we'll go through some of the results, but ultimately found that this is highly effective in treating sleep apnea and now actually has an indication for sleep apnea. So forget about if you have diabetes or not, or any of that. This actually has this specific indication. And we think the reason it works is because guess what? It helps people lose weight.
Yeah.
But it does this. So do you want me to go over some of these results real quick?
I would say do the we got a few minutes. Why don't you just give the highlights, because they are impressive.
Yeah. So this was almost in 500 patients that were that had moderate to severe OSA. So they did that AHI index. It was over 15. Got up to 10 or 15 milligrams weekly of Zepbound, which is kind of a typical dose. Treated them for a year and found that there was about a 60% reduction in the number of those apneic episodes, and about half of the patients completely resolved their sleep apnea. They got that AHI down to less than 5. Versus about 15% on placebo. So people did lose about 20% of their body weight. So, they think, again, that the main reason is people are losing a lot of weight, but just another benefit of weight loss of these drugs, kind of, et cetera.
Yeah. And you know what? As I'm thinking about these drugs, both Mounjaro and Ozempic have the indication to reduce cardiovascular disease, or at least the ones with Mounjaro is coming. And it probably relates a little bit to improving sleep apnea in the people that were entered in the clinical trials. Mm-hmm. They didn't really screen those folks carefully. So it's really hard to separate out the tremendous amount of benefits from losing weight.
Yeah.
And so it's, and kudos to Lilly for doing a study specifically on it. So it's, that's shocking beneficial.
Yeah. And if you're listening, you're saying, hey, my partner's been snoring for years, but they don't have diabetes. I've been trying to lose weight. Here's another way to get access to these medications, which is fantastic. So I would say start with lifestyle. For what it's worth, I did all the other over-the-counter stuff, the nasal strips, different pillows. Didn't really find that they worked specifically, but people try those too. I mean, if you go to Amazon and type in sleep apnea, a zillion different things will come up. And for some of the people, those work. So you can always start with those too. But, weight loss is always going to be part of like your treatment plan.
Yeah. Now, what about surgery?
Well, let's talk about CPAP because that's the main.
Sorry,
main treatment.
Skip the main treatment. I'm sorry.
So what is CPAP? Everybody knows about this now. So it stands for continuous positive airway pressure, and what that means is, particularly as you, so it's a device. You wear this mask. A lot of them are just kind of like nasal cannulae now. It's not like a full mask that goes over your face. And when you breathe out through your nose, it pushes back a little bit air against you breathing out. And what that does is it keeps those airways open because there's always constant positive airway pressure in your airways so it doesn't collapse, you don't snore, you don't have these apneic episodes.
Jeremy, it's not just a little nasal cannula. You're wearing a mask.
No, I'm telling you, the one I have is just this little thing over
Well, how
your nose.
does that open your airways?
So it's just pushing air through your nose. You can get a full facial mask, but like now they've moved more to these just nasal ones.
I mean, I think most people consider these Roger Ramjets. In fact, I brought an old one in.
Oh, yeah?
To show people what they used to look like. And they've gotten
it's a great venue on a podcast to show people. What is that?
that's an old CPAP machine they used years ago. So a lot of people may have had a partner with an old one.
Well, for people listening, Steve has like a Star Wars
this is an
helmet.
old CPAP machine. And
it's a good visual joke.
Well, if you go to your browser and type in new CPAP machines, you'll see a lot of them with the clear plastic mask.
Right.
And you know what? I'm glad that they have newer ones, and maybe yours isn't that bad.
Yeah, it's not. It's covered by insurance if you get the diagnosis, and there is an adjustment period. It's weird to wear it, and like breathing out while you're having air pushed back in your nose is a weird feeling. But these things kind of auto adjust with how much you need. So within a couple minutes, it kind of figures that out. And then, I sleep pretty well with it. I'd rather not sleep with it. But, it's completely eliminated snoring and, maybe saved a relationship. But
do you travel with it?
I do when I travel with her. And I like when I don't travel with her because then I don't have to take this thing and I can just snore away. Have I noticed that it's made my day to day much better or anything like that? Not really. Maybe a little bit more energy during the day, but it's definitely effective if you can tolerate it. And so that's the main treatment: weight loss, CPAP, and then if those don't work, then we get into the things that we're just not experts in. Seeing a specialist about surgical options. There are some dental devices that you can actually have a dentist make that is a mouth guard essentially that kind of changes the orientation of your jaw a little bit to hold your mouth open.
Yep.
So there are all kinds of different kind of approaches. Chances are something will work. And when you treat it, guess what? It helps all these things, reducing the risk of heart attacks, strokes, sleeping better, all these things. So
they've measured those.
Yeah.
And then they, in the Lilly Zepbound study, they did patient-reported outcomes, and 99.9% said their lives were better.
Yeah. They had in that study, their blood pressure was better, their markers of inflammation were better, their sleep outcomes were better. So I think the point that we're trying to make here and kind of starting to wrap this up, super common, especially in people with diabetes. And if you have type 2 diabetes, it's almost a given that this is present. So think about it. If anything that we've said resonated in terms of symptoms, things like that, it's super easy to get diagnosed. And then now there's a host of treatment options, including weight loss medications, which maybe you didn't have an option to get on before. So it's kind of a new day, I guess, for sleep apnea. So we wanted to bring awareness to this topic. And like I said, I was kind of blissfully ignorant about it myself, but realize now and more aware of it and what it's like to go through this treatment process and talk about it a little bit more with my patients, including you, Steve, who you just failed your sleep bang test.
Oh, sorry.
So we got to get you screened. Yeah,
Jeremy, you don't know how happy I am because I'm always talking about my complications on these podcasts, and finally, you got a frickin' complication that you can talk about, and I appreciate you being open about it as well.
Yeah,
and. I think all of our listeners out there, whether it's you with a potential problem or someone you love or a friend, it's such an important underdiagnosed and serious condition if left untreated.
Yeah. Well, I'm glad you can take comfort in my misery, Steve.
I really appreciate you sharing your experience with all of us. I'm being serious now.
All right. Well, like, share, follow, all those kinds of things. Donate if you can. We do all this completely for free. So we really do rely on your donations and your support, or just simply email us and you like it, or comment. I look at the comments on the podcast every once in a while to see if there's anybody said anything new. So say, Jeremy, I liked this podcast that you said these nice things.
Have your partner record your snoring, send it in so we can listen to
We're
it.
going to put a montage of snores.
That's a good idea.
All right, everybody. We'll see you on the next one. Thanks for listening.